I'll yield to my colleague, the Honorable Chairman of the Congressional Black Caucus, Congressman Stephen Horsford of Nevada.
I want to thank the gentleman for yielding. I want to thank both Congressman Jackson and Congresswoman Sheila Sherfilis McCormick for their leadership in co-chairing and co-anchoring the Special Order Hour for the Congressional Black Caucus, and to the former Speaker and to my classmate, Representative Donald Payne Jr., for his tremendous leadership and personal lived experience on this very important topic, and to so many of the other members of the CBC who have spoken on the importance of recognizing November as National Diabetes Month, and to highlight the disparate impact that diabetes has on the Black community. According to the U.S. Department of Health and Human Services, Black Americans are 60% more likely than white Americans to be diagnosed with diabetes by a physician. Additionally, the health outcomes of Black Americans diagnosed with diabetes are worse than the outcomes experienced by white Americans. Black Americans are 2.5 times more likely to be hospitalized from long-term complications, 3.2 times more likely to be diagnosed with end-stage renal disease, and are twice as likely to die from this disease. And we know that the rate of diagnoses among Black Americans is on the rise. Over the past 2 decades, the prevalence of type 2 diabetes for Black and Hispanic youth has increased by 95%. Now, at the start of the 117th Congress, the Biden-Harris administration and Democrats in the majority in the House and the Senate made it our priority to lower everyday costs for the American people and to improve the affordability of life-saving prescription drugs like insulin. And we've delivered on that promise. With unanimous support from the Congressional Black Caucus and House and Senate Democrats, President Biden signed into law the Inflation Reduction Act, which capped the cost of insulin at $35 per month under Medicare prescription drug coverage, traditional Medicare, or Medicare Advantage. And because of this action, now some of these private companies have extended that reduced cost to others, including children. The IRA has significantly improved the affordability and accessibility of life-saving insulin for the 1 in 10 Americans with diabetes, including millions of seniors who in some cases were paying as much as $400 for a month's supply of insulin. And after the insulin cap for seniors went into effect, the top 3 insulin manufacturers reduced their prices for all Americans, as I indicated. This is what we can do when the government works for the people. This is what the Democrat Party does when we're in the majority. We put people over politics, and will continue to do that on behalf of the American people who deserve nothing less. I want to thank my colleagues of the Congressional Black Caucus, including Congresswoman Shontel Brown, who led the CBC in a press conference today by marking National Diabetes Month, as well as all of our members for their work in uplifting the stories of their constituents who are living with diabetes and who have benefited from the insulin cap under the Inflation Reduction Act. Thank you very much, and I yield back.